So for antenatal consultation, all these pages here are found in this side, right? You can choose to enter them individually by page, or you can just use the ANC consultation, which covers everything. Now here is peculiar. Now for some facilities who want to request for investigation before the consultation, they will just come here, select the patient, and then here they will just select the labs. So the whole idea is to make the time the patient spend there shorter. So once the patient comes, a nurse will just prescribe all the routine drugs for the person to go and do, pay and go and do at the lab. So by the time the labs are ready, it will be on the turn of the patient to see the midwife herself. So it is better than seeing the midwife, prescribing the lab, going to the lab, coming back, all those back and forth. So this is an approach that I had preferred, or I prefer most facilities use, because it save the patient time there. So you can add as many drugs as possible, and then you save. So once you save, these labs will go to the cash point if the person has to pay, or if it's a person is a private insurance, then the person can go straight to the lab to do the test. So once the patient gets to see the midwife, the lab might be ready, and then he can look at the labs and then just prescribe the additional drugs, whatever, and then the patient can leave the facility. But if you want to do everything yourself as a midwife, then fine, you come to the ANC consultation. So that's where I am now. So I'll select the patient, and then ANC consultation. So here you choose either it's a new registrant, attendance, making 4th visit, or making 8th visit. So if the person is a new registrant, you choose new registrant. If the person is making the 4th visit, the 4th visit can be the first in your facility. The person can start the ANC somewhere. But if the person is making a 4th visit in your facility, choose the making the 4th visit. So all of this is the entire pregnancy. It's not only about your own facility. So if the person has started a thing from somewhere, then follow the whole concept, not only your facility. So if the person was registered somewhere and now is coming to your facility as a new client, you are now coming to register, you don't need to choose new registrant. New registrant is somebody who is just coming for the first time during a pregnancy, whether your facility or another facility. So if it's new registrant, you choose. If it's making 4 visits, if it's making 8 visits, any other one, you choose attendance, right? So if you choose new registrant, you're going to have this mail involvement, IFA supply. You choose the time, the number of times the person is taking. This also applies to across the patient pregnancy period, not only at your facility. The mother's parity, seen at. So at the time of at the time the person you are doing this new registrant patient, what time were you seen? Was it seen at the 16th week, seen at 34 week, 36 week, before 16th week, any other, choose other week, right? The duration of pregnancy at the time of the registration, like this or that. Mother's height, either this or that, but the person referred in. No, so you choose all these options. Yes, right. Now if you choose what they call attendance, this thing will change, right? So depending on what you select, it's going to be this or that. Okay, so let's pay attention to them. So the vitals will show here. If not, you can take your own vitals, enter it and save. So clicking the patient complaint. So if the person comes with a complaint, you can just document it. If not, you can say no complaint. This part is important. If you don't feel it, you cannot proceed. The rest here are all optional. So all these things, as I showed you, they are also here in this side that can be filled individually, or you can fill it here. Then diagnosis. So pregnancy is Z34. So you can choose any of this one. Either submission of normal pregnancy. This if it's the first pregnancy, choose. If it's other, choose. But at the end, there should be either of these things of this one. So for the first time, you choose principal, and the case is new. If it's for subsequent visits, so first time is that this is the first point of call for the person's pregnancy period. If the person has gone somewhere first before your facility